Increasing doula access for Black mothers, a patient-centered care approach for improving Black maternal health outcomes. Presently, the United States is grappling with the staggering inequities in maternal mortality rates that disproportionately affect Black women. Central to these inequities are previous and chronic health conditions, a lack of consistent prenatal care, and access to quality, culturally relative care. More and more, doula care has entered the conversation regarding how to address the Black maternal health crisis. Policymakers and healthcare providers have encouraged rapid expansion of doula access for all pregnant women, especially low-income Black women. This documentary explores how doulas prevent or reduce maternal deaths. In order to understand why doula care may be a critical component in addressing Black maternal mortality, we must first understand why this crisis exists. Between 2007 and 2016, Black women experienced 40.8 pregnancy-related deaths per live births, a rate 3 times higher than white women. We can also not ignore the systemic intersection of racism and sexism that exists in every part of our society, as evidenced in healthcare policy and the implicit bias of care providers. In addition to this, hospitals that predominantly serve Black women tend to be under-resourced and therefore lower quality. According to analysis from ProPublica, women who experience hemorrhage at hospitals predominantly serving Black patients face a higher risk of severe complications than those who receive care at hospitals with more white clientele. Black women are much more likely to receive no prenatal care or to receive it later than the first trimester. Black women are more likely to suffer from hypertension and preeclampsia, which increases the chances of severe adverse health outcomes. So how do doulas address these concerns? Doulas provide physical, emotional, and relational support to women during pregnancy and birthing. Doulas serve as an advocate for mothers and assist with navigating the healthcare system and the frequently insensitive clinical care offered Black mothers. In 22 trials involving 15,288 women, the data concluded that women allocated continuous doula support were more likely to have spontaneous vaginal birth, less likely to have interpartum analgesia, or report dissatisfaction with their birth experience. Their labors were shorter, they were less likely to have a cesarean or an instrumental vaginal birth, less likely to have a regional analgesia, or a baby with a low APGAR score. When we look at the risks to Black mothers, hemorrhage is one of the greatest. Black women are at a much higher risk of severe morbidity or mortality following a postpartum hemorrhage than any other racial category. Of course, a doula cannot treat a hemorrhage, but they do provide invaluable emotional and relational support and serve as advocates for women who aren't believed to be in real pain and are frequently ignored by clinicians. It is in these moments that a hemorrhage may become fatal. Serena Williams has shared her experience with hemorrhage following the birth of her daughter. Having had a history with hemorrhage, Williams knew to alert the nurse. Despite her medical history, doctors did not initially believe her. Without determined advocacy, her postnatal complications could have turned fatal. According to a 2017 Cochrane review of 26 studies from high and middle-income peer countries, there are no adverse effects to the care doulas provide. But while the benefits of doula care are widely documented, there is very little research available demonstrating a direct link between doula care and a reduction of maternal mortality. This lack of data makes it difficult to draw any hard and fast conclusions. However, the anecdotal evidence and lived experiences of Black and brown mothers should be believed. Expanding policy that ensures easy and affordable access to doula care for Black mothers is a step that has no known negative consequences and a long list of potential benefits. Coupled with considerable investment in addressing other systemic factors that contribute to the Black maternal mortality crisis, we could save hundreds of lives each year.